Just a few days ago, the world marked World Hepatitis Day, a global reminder of the urgent need to raise awareness about a silent, deadly disease, hepatitis. Despite affecting millions across the globe, many individuals remained unaware that they are living with the virus. Welcome to the Lade Health Show. I am your host, Goodness Kanu, for today, and I'm excited to guide you through this special episode dedicated to the hepatitis awareness and prevention. Joining us today is someone who has made remarkable contributions to hepatitis education and public health advocacy. He is a passionate and young professional who brings a wealth of knowledge and insight to the table. With me in the studio is a man of multiple capacity and digitally versatile fellow, Mr. Angwa Israel or Nani, a public health scientist with both academic and practical experience in the field. He earned his first degree in public health from the prestigious University of Calabar and is currently pursuing his master's degree in public health. Mr. Israel has authored and co-authored several academic publications on hepatitis B, featured in the American Public Health Journal and in the Nigerian Biomedical Journal. In addition to his research contributions, he holds over 15 certifications in health-related courses, underscoring his deep commitment to health education and disease prevention. It's an honor to have you on the show, sir. You're welcome.
Thank you very much for having me. It's my pleasure to be here.
Alright then, let's dive straight into it, Mr. Israel. For the benefit of our listeners, can you please break it down for us what exactly is hepatitis and why people should be concerned about it?
All right. Hepatitis is the inflammation of the liver. To put it very simple for our viewers out there, it can be caused by a variety of factors, and most commonly, it is linked to viral infections, hence the name viral hepatitis. There are five major types of hepatitis: A, B, C, D, and E. Each of them have different modes of transmission with varying level of severity. Now, for hepatitis A and E, they usually spread through contaminated food and water, and they are often associated with poor sanitation. Now, for hepatitis B, C, and D, on the other hand, they are primarily transmitted through blood and body fluid. This can include unsafe injections, unprotected sex, and other forms can be from mother to child transmission at birth in some cases. In terms of severity, let's look at hepatitis B and C first. They are the most dangerous because they can become chronic and lead to serious complications like liver cirrhosis and liver cancer. Now, let's look at some statistics very briefly from World Health Organization now. About 300 million people worldwide are living with hepatitis B and other strands or other variants of hepatitis, of which most of them are unaware of their status. Now, in Nigeria alone, 1 in every 8 persons in Nigeria are infected with hepatitis, and this is the reason why this can be said to be a major public health concern here for us at home in Nigeria. And that is why awareness is very, very important, because hepatitis can be often said to be silent, but it is a very deadly and life-threatening infection. The good news is that hepatitis B and hepatitis generally is both preventable and manageable if detected early.
Now, Mr. Israel, let's talk about something that often stands in the way of proper understanding: the misunderstandings and misconceptions. Some people believe that hepatitis only affects drug users, or that once you're affected, it's a death sentence. Can you please help us separate the fact from fiction?
Absolutely, that's a very important part of this conversation today. When you talk about hepatitis, there are indeed a lot of misconceptions surrounding it. Some persons don't even know what it is, but to us, our viewers out there, we are bringing this to tell you what it is, how it can be prevented as well. Now, hepatitis contributes to stigma, to fear, and sadly late diagnosis. Now, the beliefs people have is what can result to these that I've highlighted. First, the idea that only drug users get hepatitis is very, very fallacious. While sharing needles and the like is one mode of transmission, many people contract hepatitis through other routes as well, like unsafe medical practices, unprotected sex, or even from mother to child at birth. So on and so forth. There are many risk factors associated to that. And then another major misconception related to hepatitis is the fact that some persons say hepatitis is incurable. That's very, very untrue. In fact, there are vaccines available now for viral hepatitis. Hepatitis A and E are usually self-limiting. C and B are, while they are very, very serious, they can still be manageable. Vaccines go a long way in keeping us healthy and protected from hepatitis. Perhaps some persons may also be thinking, I am feeling okay, I am healthy, I don't feel sick, so there is no need going to check my status about hepatitis. You may be killing yourself unknowingly. To you, as a person, hepatitis often does not show symptoms at all. Whenever symptoms begin to manifest, then you should know that it is at a critical stage already. That is why regular screening is very, very necessary. So, in summary, hepatitis is not a death sentence. It's not limited to a specific age group, and with the right information, the right action and support, it can be prevented, it can be treated, and it can even be cured. Thank you.
Thank you very much, Mr. Israel. Let's talk solutions now, Mr. Israel. How can people protect themselves from hepatitis, and why is screening such a critical step?
Great question. That is indeed. The truth is that hepatitis is preventable, and early detection can literally save a lot of lives. Now, first and foremost, vaccination is the most effective way of which we can protect ourselves against hepatitis. Secondly, practicing safe behaviors such as using protection during sexual intercourse, ensuring that some of the needles we use are sterile and not just that. Sharing of sharp objects should be avoided. Now, when it comes to screening, that is where many people drop the ball. Now, let's talk to our viewers. Hepatitis B and C is often does not show symptoms until very serious damage has occurred. That is why routine testing is very, very crucial, especially if you fall into a high-risk group or live in a region with high prevalence like us here in Nigeria. When you are tested positive of hepatitis, don't panic. The first step is to seek proper medical care from a qualified medical practitioner. Remember, it can be managed and curative treatments are now on. So I would say that you should go get vaccinated, stay safe, get tested, and take actions early. Some persons take actions when things have deteriorated. That is not advisable. Take actions early. These simple steps can protect not only you as a person, but those around you as well. Thank you.
Mr. Israel, for those listening and wondering how they can make a difference, what practical steps can they take to join the fight against hepatitis?
Okay, the fight against hepatitis cannot be done by one man. It's a collective effort. Everyone has a role to play in ending hepatitis, whether you are a healthcare professional or an everyday individual. The first step is to take advantage of free screening opportunities. Secondly, public awareness campaigns, very, very necessary. You use your voice as well, both online and offline. You share facts about hepatitis to people. And then thirdly, you help educate others. You don't need to be a doctor before you can push for some of these things. Even without being a medical doctor, you can talk to friends, you can talk to families and neighbors about hepatitis, especially about the importance of getting tested and vaccinated. And then finally, you will advocate for a stronger health policy. Together, when community speaks, I tell you this of a truth. Some persons don't believe it, but it's a reality. When community speaks, policymakers will have no choice but to listen to the community. Eliminating hepatitis requires a collective effort. Your effort and my effort, your effort as well, can help to stop the spread of this. And it can start with informed and empowered individuals, just like you listening to us today. Thank you.
What an enlightening conversation we've had today. We've learned that hepatitis is not a death sentence, rather it's a challenge that can be conquered through awareness, early detection, prevention, and proper care. Remember, knowledge is power and action save lives. With the right steps, we can work towards a world free of hepatitis, even in our lifetime. Mr. Israel, just before we bring the show to a close, what final message would you like to leave with our listeners?
Okay, let me talk to our viewers out there before we bring the show to a close, like our anchor today said. Now, you need to get tested, you need to get vaccinated, and most importantly, spread the word, not the virus. Your actions today can save lives tomorrow.
Thank you very much, Mr. Adrian, for sharing your expertise and your passion with us.
Thank you.
To everyone tuning in, remember your health is your truly priority. Stay safe, stay informed, stay proactive. Until next time, this is the Lade Health Show. Bye for now.